All right, everybody, time to put that jerky down, those gummy worms. Well, you can continue eating them if you like, but it's time for us to kind of move on to our next section. I would like to say this morning has been great. So in the spirit of engagement, we've had a lot of engagement in the chat, people making comments. Thanks to our facilitators for getting us off to a great start. So with that, we're going to go ahead and go on to our next section. CE Studio logistics. We're going to talk about CE Studio planning and preparation, scribing, and then introduction to our demonstration studio for this afternoon. So take it away, team.
All right, thank you. If we can get the slides up, possible. All right, thank you. So the planning and prep part of a CE Studio. Next slide. So in order to create a studio, we typically have 5 team roles. They are the point of contact, recruitment lead, the facilitator, the scribe, and then an individual that is in charge of the logistics. The point of contact is responsible for communicating directly with the study team throughout the studio process. They communicate with the study team to determine several potential dates and time for the studio. They send out the calendar holds to the study team and the community engagements team. And they're also responsible for sending out the Zoom invitation for the actual studio once a time has been confirmed. Following the community engagement studio, they are also responsible for following up with the team in order to share the conversational summary and experts' recommendations, which we will talk about in detail a little bit later. And they also are in charge of requesting and reminding the research team to complete an evaluation, which we really, really encourage them to do so we can know how their experience was. In the event, I will say that a study team wants to get additional feedback from the community experts or even share the results of their study, they will often contact or connect with their point of contact. And this role is incredibly important because oftentimes when a particular research wants to potentially do a studio in the future for a different project, they will often reach out to their previous point of contact directly. So there's also the recruitment lead. The recruitment lead is in charge of getting people to the studio, recruiting. So they create the screening survey, and the survey that allows us to screen and or determine who will or would not qualify as an expert for a particular studio. They also create the flyers and they create the messaging that will be used to inform communities and recruit. They also are in charge, responsible for creating and updating a spreadsheet that documents which individuals or organizations have already been contacted, the method in which they were contacted, and whether or not we've received a response. So, and they're also responsible for making sure that the experts are comfortable using a Zoom platform and are made aware of the study topic. We also have the facilitator that leads the discussion. They should be neutral, be very personable, and they make sure that the studio flows nicely and keeping folks engaged and encouraging all experts to speak and sometimes to encourage the researchers not to speak if they start to take over. We also have the scribe, which we will also talk about a little bit later. That individual is responsible for accurately documenting and documenting all of the feedback that is given to the team, to the study team by the experts. We will go into detail a little bit later, but it is an incredibly important job because that is how the research team will be able to take what they have learned and heard from the studio and apply to their research project. And they also assist with drafting those recommendations. And last but not least, you have the person in charge of logistics. They assist with the scheduling with the recruitment lead and with Zoom orientations as needed, but they also make sure that compensation occurs and that everything on the back end is accounted for as it relates to finance, documentation, consent, etc. I will say we have these 5 roles, but they don't always have to be rigid. For example, I think as Tiffany said earlier, at the UMC, we do not have a dedicated team just to community engagement studios. So we often require flexibility. For example, we recently had a studio where Tiffany was a point of contact, recruitment lead, and facilitator. And I worked on scribing, and our team member Leah worked on logistics, and it can be flipped. So it really just depends on what the needs are. And we also encourage cross-training, at least within our institution, because you never know what's gonna happen if someone needs to drop off, or if there's an emergency, knowing that you have a team member that is prepared and has the ability to take over when needed. I'm going to pass this off to Meghan, who I think also has a lot of experience with the idea of double and filling roles. Meghan?
Yeah, thanks, Devan. Like I said earlier, we are still fairly new in implementing these studios. So at first it was really manageable for one of us to do, or one or two of us to do a lot of these roles. And I think as Bree and Tiffany talked about, with moving to the virtual format, we've received an influx of requests and have expanded our team. The way our CTSA is set up is our community engagement program is separate from our recruitment program, is the one that helps with making flyers and things like that. So our teams are the CE Studio team. So oftentimes we've moved to a model where 2 of us are either the point of contact, and then we'll often act as, let's say if I'm the point of contact, I might be the scribe as well. But it helps us to cover if someone has a meeting they can't miss, if folks are out on vacation. So we do try, we'll usually send out, hey, I have a request this month, or we have 3 studios, who wants to do what role, but largely 2 of us are acting as the point of contact, as well as there's 2 of us that are the main facilitator. As Tiffany and Bree are going to talk about a bit later, facilitation is definitely a great skill that takes some training to do. And I think, Tiffany, are we going to launch a poll? Okay. Do you want me to introduce it, Tiffany, or this is Tiffany's brainchild, so I don't want to not do a great job here. So we thought some of these questions would be fun to just break up the day. So we're using this like a Jeopardy poll here. So this is, what do you all think is the most challenging patient demographic that we've recruited? So we can recruit that group for 100. So we've got a couple of different things here. I actually think we launched all 7. We don't want to do all 7, do we, Tiffany?
We do not. We're just going to do 100 right now.
All right, yeah, let's just do 100 for now. So we've got 1 non-cisgender individuals who work in spaces that provide care and safety for LGBTQ in the Mississippi Delta. Gay African-American men who live in 2 specific geographic areas of Seattle to discuss HIV. FA, I'm not sure what that means, but I see. We're unable to submit all the questions because they're all showing.
Well, we might have to take the poll down, planning team.
Yeah.
And we might have to relaunch or try it again.
Yeah. Tiffany, do you want to tell us the answer for the first question at least?
No way.
No way? All right.
No way. No way. What if there's a prize? I don't know how this all works. Ed clapped, he agrees. So we might come back to it. Well, Meghan, do you want to go ahead just so while they're figuring out polls, unless Alicia or Colleen, you want to pause me?
We're going to figure out polls and launch them as individual questions. So Tiffany, thank you for level setting that there's going to be flubs because this is live, and I'll take the first flub, one for Alicia.
I've probably had multiple already, no worries.
Exactly.
So how about this, Meghan, you just continue on. Alicia or Colleen will interrupt us when they're ready to launch the first one. Sound good?
Sounds great. Thank you.
Perfect. Thank you.
Yep, and I'm having a flub of my own. My chat is enlarging and my screen is minimizing. Okay, I got it now. Devan, are we okay to move on to the next slide, or did we want to pause for questions here?
I think we could pause for questions. I did note someone asked if we record, and I will say, I know some people answered from other institutions. We do record the audio of our community engagement studios to help with the scribing process. That is new to the virtual studio model, but we do not typically share that information to the researcher. And that is something we are going to go into detail about later, the why that is. So I just wanted to make sure I answered that. Okay, and if there are no other questions, we can move on, which it looks like we have. The new slide is up. So this is graphic here. I really just want to highlight here that after the planning meeting, which we will talk about, in which we get the idea and we understand what it is the researcher wants from the studio, the CE team takes on the majority of the work in the facilitation of the community engagement studio. Basically, someone mentioned like a Wizard of Oz analogy. You're like the man behind the curtain or woman behind the curtain to make everything work. And again, it is still very much collaborative, and we do keep in touch with the research team and communicate with them regularly. But they are typically only responsible for creating their presentation and composing questions for the studio, or composing questions for the studio after the planning meeting, and we do everything else. Next slide. Okay. Well, did we have any questions for the previous slide? Okay. All right. If not, we will move on. Okay, Megan.
Yeah, so the way that at least we handle it at U of M is we typically get the request from the researcher, hey, I'm interested in doing a community engagement studio with you. So we will send over an FAQ sheet to them so that they can prepare any questions that they might have for us. And we do set up the initial meeting to prep them. So really what this meeting covers here is the four bullet points beneath it. And I wanted to touch on what the research team thinks they need versus what they really need. An example I have is we were working with a health communications researcher early on in the pandemic who was wanting to re-engage patients to come in for cancer screenings. He felt like for so long, folks were hearing, don't come to the hospital unless you're sick, but wanted to figure out how do we change that messaging so that folks are coming in for their mammograms, colonoscopies, and things like that. And the more we talked to him, he's like, you know what, we have a patient advisory council. I can send this information to them for feedback. What about figuring out how we can get folks to sign up for an app that tracks exposures? And he's like, I don't really like that either. So why don't we figure out, he felt like a lot of messaging was around that folks still aren't wearing masks and aren't taking precautions very carefully. So he wanted to focus on what he was calling COVID protectors. So people who are protecting themselves or a medically vulnerable loved one from COVID. So someone who might have cancer or COPD, someone that's more at risk of severe illness or death if they were to contract COVID. So I would say that those are two very different topics that we ended up on. And we really figured this out just through discussion and bouncing ideas back and forth off of one another. And it really helped us to narrow in on the focus of the studio and define the expert characteristics. So our idea was coming up, the way that Michigan sort of approached their COVID response plan is in 8 different regions. So he's like, well, let's recruit someone from each region then. So we have a representative sample from our state. And that's the researcher I was talking about earlier, who, because of this idea, has been consulting with the Sesame Street team and HBO about COVID protectors, which is pretty interesting and is something that we've shared back with our experts. And this particular researcher has also been involved in our Community Engagement Alliance grant, the SEAL grant. So like Tiffany said, he wasn't necessarily a community engaged researcher, but we've brought him over to our side now. But it is also helpful for us to review the goals and questions and to clarify timelines. So we'll say, you know, hey, we need any slides that you have about a week beforehand or whatever it may be. I know our team likes to put together an annotated script just to review and go over roles and reminders. And then after our meeting, we're able to send a follow-up email, confirm availabilities, and to send out a slide template. Any questions about the research planning meeting?
And I would love to hear from any of our colleagues who have piloted studios or are conducting studios. If you've had any kind of tricky conversations that you've had to navigate with researchers, maybe who just were absolutely dead set on doing a studio a certain way or with a certain demographic. I can share just really quickly once when I was unavailable for some reason for a particular studio. Usually I'm involved in some way, shape, or form in all of them, but there was one studio and I don't remember why, but I was not involved. And my old boss, Yvonne Jostin, who was responsible for co-developing this model, had handled this studio. And it was a pretty forceful researcher who really insisted on having two really distinct demographic of people in the room to talk about barriers to participating in a project. And I will tell you now, 1,000 times, please don't do that, because what you'll find is that one group of people will never feel comfortable sharing. And that's what happened in this studio. We joked that she was at the end of her career and ready to retire, and she just did not want to argue with a researcher anymore. She had one foot in Costa Rica. And so they did the studio, and she said, and which is great, you know, we learn a lesson in every studio. After the studio, she had multiple Black women come up to her and say, hey, could I chat with you for a few minutes? I didn't feel comfortable sharing this, and I wanted to say such and such. Or, hey, could I email you later, because there were some things about my experience that didn't line up with others, but I just didn't want to distract the conversation. So for a variety of reasons, people will not share their story if they feel like it's not relevant, right? So a great example is health literacy. I would never have a group of people in the room who have a really high health literacy with a group of people who have a low health literacy, because my low health literacy folks may not feel comfortable asking important questions. And that's what the researcher needs to hear. Hey, there's a whole group of folks that you're going to try to recruit for your study that don't understand what you're doing or why you're doing it. And therefore they probably will not join your study. But if I have those two demographics in the room, I think we had a colleague who did two different groups of people who had different native languages who were not all bilingual. Please don't do that. Have two separate studios. We could talk all day about why that's really important, right? So it's really just applying some of those common sense measures. You want to make sure there's a commonality in people's experiences. That is not to say you can't have individuals who are Black and white and Spanish speaking all in the same room. You just need to think through, like, what's the shared experience? What brings them together? What's the commonality? And is there any barrier that you're putting into place to them feeling comfortable sharing that experience? So sometimes y'all are going to have to really own this and get super comfortable respectfully pushing back on researchers. I have had to tell a researcher before, hey, I've done this for 11 years. I've learned a lot of lessons. I need you to trust the process. And they have generally. So just a note of thought. Any other comments or feedback before we launch our first poll? Because we're ready for the first question. Okay, I guess let's launch this first question. Okay, we can recruit that group for 100. Who was the most challenging patient demographic that we've recruited? Y'all can read. I'm not going to read this to you, but notice that there is an all of the above at the bottom as well. So submit your answers now. Oh, we're getting close. 11 more people. We probably won't have everyone because clearly I'm not going to participate. All right. Can we end the poll? Let's see, what did we have? 20% went with the first answer, 12% second, 18%. Oh, all of the above, 38%. Okay, the real answer for this question. Our team in Nashville was asked to recruit gay African-American men who lived in 2 really specific geographic areas of Seattle to discuss HIV. That is the only studio that we have had to cancel because we could not recruit enough people. They didn't even exist in those 2 zip codes when we ran the numbers. I don't know how they thought we'd recruit individuals who don't exist. They even had a gay African-American male team member of their department from Seattle. He was unable to recruit anyone as well. So I thought I'd share that because that's the one in 11 years that we were like, this is definitely not going to happen. So kudos to everybody who went with that. We had 10 of you. Tricky that all of the above, 38%. So I got my eye on you. There'll be more poll questions in just a few moments. All right. I think, Megan, I think you're moving us along, right?
I think so. Yep, we're ready. Yeah, I see Stefania saying, if you got the answer right, treat yourself to your favorite snack.
Perfect. Perfect.
All right, let's go to the next slide, please. So I think Devan and Leah can talk a bit more about this, but why those meetings are so important with the research team. So this example on the left is something that the research team submitted to talk about their study. And this is what we ended up with on the right. So we can be guilty of this too as staff members, is putting all of the information on here. But when we sometimes step back and can think about, okay, what's the simplest way to be able to present this? So this is an example, I think, that Tiffany talked a bit about having some difficult conversations or some coaching. We'll often say, hey, we want to make sure this is in some really plain language, really easy to read, making things easy for the most amount of people to be able to respond. Here's our suggestions. So this is our translation here. Tiffany and Devan, did you have anything to add?
Megan, I was just going to jump in and say, I think to your earlier point, this is all about, again, setting those expectations. So something that we review in the planning meeting is how we will be reviewing their slides, that's something that they'll expect. We'll review them and we might send revisions. Because again, if that comes as a surprise, I think folks can get a little bit defensive about that. We only have 3 more minutes, so if it's all right with everyone, I am going to push us along to the next slide, if that's all right.
Yeah.
So I wanted to quickly go over some of the differences between coaching a researcher in an in-person versus a virtual space. So as Tiffany mentioned, the basics are the same. We're still using first names. We're trying to foster open and honest communication. We're using plain language. One of the big differences, though, is that we're not able to eat a meal together. I think Bree mentioned missing in-person studios, and I miss that as well. I miss sort of that opportunity right at the beginning to all go get food together, have some time to have casual conversations where we can greet folks. And that's why, as I think others are going to talk about later, Zoom orientations are so important, because that's an opportunity for you to sort of pre-build a little bit of that rapport, because if those community members have already had a chance to talk with whoever the facilitator is going to be, or a member of staff who's going to be present, I think it helps them feel a lot more comfortable. And Alicia, you can go on to the next slide. Just to give a quick overview, and you'll get all of these at the end, we have broken up our time. This, I will say, is reflective of the Vanderbilt team. I think, at least in conversations with the University of Michigan, it seems like this is on par as well. But just to give you an idea of how much time we're spending with the research team, on our end, it ends up being about 5 hours, with the understanding that 2 staff members are attending the planning meeting. But we'd really try to keep that, as Tiffany mentioned earlier, pretty minimal for the study team, so they're not spending more than a couple hours in meetings before the actual studio. You can go on to the next slide, Alicia. And finally, just with a lot of studios happening, we too have seen an increase in the number of studios that we're working with. It can be challenging to even just stay organized as a team, to keep everything straight when you're dealing with 8 different populations recruiting in all different areas of the country on about different diseases, different topics, with different researchers and different projects. So we have had to try out some systems to stay organized. And this is sort of our lesson learned, at least from organize staying organized in terms of with the study team. Again, I think it goes back to setting those expectations. We try to update people either weekly or bi-weekly, depending on how far out the studio is. We don't want to send them an update every week saying, we have no updates, we'll be in touch soon. But if they're on a really pressing deadline, we try to let them know that they'll hear from us every week. And then in terms of our own internal communication, we use a lot of shared resources. So what you see on the screen right now is our Excel spreadsheet, which keeps track of all of our studios, including each of those roles. So I had to cut it, but we have each of those roles specified out. So who's leading recruitment, who's leading our point of contact. And we use that at our weekly team meetings or bi-weekly team meetings to go through and give updates on studios. Something that we've learned is not to fight against sort of the flow of your institution. So we've tried to use other tools like Slack and Trello, but the thing is we just don't use those at our institution regularly. So what we found to work best is to use whatever we're already using for all of our other projects. So we're not having to add on something else with studios because there are so many rapid changes. I find that if I'm having to log on to another software to update something, it just becomes burdensome and not actually helpful. So we personally use Google a lot. I think we might shift to Microsoft Teams because that's where a lot of our other projects are moving. But right now we use Google's that's sort of locked down to access for us only. We have a shared email as well, which we find really helpful when we're doing outreach so that any one of us can send an email and then the others can see any responses that come in. So for example, for our confirmations for today's studio, I just sent out reminders about 15 minutes ago from our shared email box. So if for some reason I'm doing something and Devan needs to see really quickly if someone has responded or if someone has a problem, she can check that from our shared email box. All right, and so I'm going to hand off. Oh, no, I forgot I had one more slide. Just a quick overview of the differences between virtual and in-person logistics. I actually think Bree touched on most of this. So unless anyone has specific questions, I think we're fine to move along.
Hey, Leah, can we go back to it for just a second? I'm communicating with folks feeling a little rushed. So just to give folks just a quick second to take a look at the grid to make sure folks don't have any questions. You can throw them in the chat if you'd like, and we can answer it while we move on. Or if you have anything you'd like to add, please feel free to do that. Okay.
Yes, we will get, I assume a copy of the slides will be sent out. Is that right, Alicia and Colleen?
Yes, we will have that as part of our deliverables. Thank you.
So I'm asking Alicia, would you like to launch our second poll only because it kind of applies to this scribing session? All right, they said that for 200. What is the most surprising thing a community expert has said during a studio?
I love number 2.
I had to come up with fake answers too, guys. We're almost there. 6 more people. I like that you all are taking this really seriously, though. I appreciate the competitive nature of the group. All right. Perfect. So the correct answer to this, which I'm really impressed with everyone, 32%, 3 community experts disclosed that they had been molested as children in a studio that was not about child trauma. So this particular studio was actually, it was a group of African-American faith leaders and CBO leaders, community-based organizations, all of whom worked with youth in some way, shape, or form. And most of them provided just youth-based programming. This researcher, however, works in the space of HIV, and she was trying to figure out how she could do more education and outreach through community leaders around this topic of safety and testing, et cetera. We had one African-American male faith leader who's a deacon mention that he felt like it was so important that we have this education to support this programming. And then he shared because he, as a young child, had experienced this. And literally 2 seconds later, another young man shared, I have to agree with you. And I want to share that I can relate. I also had my own experience. And a few minutes later, an woman in the group shared that she also had had this experience, but with a family member. And I have to say, again, I told you all I'm a social worker. I've done therapeutic groups for many, many years. And that kind of shook me for a second. I had to sit for a second and actually verbalize, y'all, I feel like we need to sit with that a second. That is really powerful. And it really speaks volumes about the need for you, for these services, for us to address this in the community. So we actually just kind of sat with it for a minute because I felt it was so powerful. That was in no way, shape, or form the focus of the studio. And that gets back to, you know, the earlier debate about whether or not people feel more comfortable on Zoom or less comfortable on Zoom. I'll just share that I am 100% biased. Having done so many groups in person and now having done so many groups via Zoom, I feel like, and Yolanda's smiling at me, she works in this space too. I think if you really want to establish rapport and have people feel comfortable opening up, there's something about that personal space that really, for some folks, not everyone, but something about that personal space when people feel connected, that they will open up and share things that they will feel validate others' experience, support them in their journey. We have people tell us a lot that community engagement studios are incredibly therapeutic for them, regardless of whatever their healthcare journey is. And I think that's important to note that this is about more for community experts than just informing a research project. This is more than that for many of them. So I just thought I would share that. So I'll be quiet and let you guys move on. Thanks for participating in the polls though.
Tiffany, before we move on, I just wanted to address one question that I saw come through about gift cards. We're going to talk pretty extensively about gift cards and compensation in just a little bit. So I'm going to hold that question, but I'm very interested in folks' experiences with choosing the right compensation. So definitely something I want to talk about in just a little bit.